Hello viewers, welcome to our FB Live session. Today we have with us Dr. Amit Langote, Consultant Nephrology and Hypertension Specialist at Apollo Hospitals, Navi, Mumbai. On the occasion of World Hypertension Day, which is celebrated every year on 17th of May, this year's theme is the measure blood pressure accurately, control it and live longer. So we'll discuss the same with Dr. Amit today. So my first question is, Doctor, how common is the blood pressure?
Blood pressure is quite common than one would assume. Almost 30% of the world's population, or more than 1.1 billion of world population, suffers from blood pressure. And it is much more common in men compared to women. Unfortunately, only 1 out of 5 patients suffering from blood pressure has it controlled properly. So 4 out of 5 are uncontrolled. It is a worrisome trend we are seeing that blood pressure, which used to happen only in older people, is now also commonly seen in younger people. So yes, it is a very common disease and not many people are aware of how common it is.
Doctor, what are the important signs of blood pressure and which should not be neglected?
Well, as you all may be aware, that blood pressure is called silent killer along with diabetes, because many times, or most often I should say, they do not cause any symptoms. But there are certain signs if you encounter that you should consider checking up for blood pressure. The first would be nosebleeds. Now, nosebleeds can also happen commonly with nose picking or blowing the nose forcefully, but it could also be a sign of raised blood pressure. Headaches, second sign. Headaches which can happen all over the head, but especially on the back side, the occipital area, could be a sign of blood pressure. When you feel short of breath, especially if you used to climb 3-4 stairs, but now even after climbing one stair, you have to pause and you feel shortness of breath or chest tightness, that could be a sign of blood pressure. If you feel chest pain, you should not neglect it. It could be a sign of blood pressure. So these are signs which are not specific to blood pressure, but certainly should raise suspicion in your mind about blood pressures. Other symptoms are very vague, like headaches, including vision blurring, which is another important sign. When your vision blurs, it could be a sign of blood pressure. You may feel fatigued very easily. That could be another sign of blood pressure. So these are common symptoms which could be dismissed in day-to-day stressful life, but certainly keep them at the top of your list, considering blood pressure as a possible culprit for them.
So Doctor, my next question is, what are the complications of blood pressure?
Well, blood pressure can cause acute problems and chronic problems. In acute problems, when the blood pressure rises very rapidly, you may get heart attacks, you may get bleed in the brain. Sometimes you may get dissection of your blood vessels, wherein your blood vessels actually get split into two. You may get pulmonary edema, which means there is water accumulation in the lung due to stress on the heart. These are common acute blood pressure changes. You may get swelling in the brain and eyes, papillary edema, and visual blurring. These are acute changes. In the long run, which is where it kills, is when you can get heart attacks, strokes, kidney problems, and even memory losses or dementia. So it is an important disease not to be neglected and to be treated and controlled properly.
So Doctor, how can we manage the blood pressure?
Blood pressure can be managed by living a very healthy lifestyle. And what do I mean by that? It means you need to do your exercises regularly, walk at least half an hour every single day for 5 days out of 7. You can do exercises like yoga and meditation, which can reduce your anxiety, calm your mind, help your blood pressure to get controlled. You should stop alcohol. You should cut down on smoking or quit smoking. You should reduce salt intake. Importantly, remember, salt does not form a part of only the diet that we eat, but also from the packed and preserved food that we eat outside, when it's the hidden soil that comes in. Along with that, you have to lose weight. You have to really check your blood pressure. Just because you don't have symptoms does not mean your blood pressure is controlled. Keep checking your blood pressure and work with your doctor to achieve a good controlled blood pressure. And what is that good control? For people who have no diseases other than blood pressure, it should be less than 140 and 90. For people who have diabetes or kidney disease or any other complications like protein leak in the urine, they should target it less than 130 and 80. Now lastly, before I leave you guys, remember obstructive sleep apnea or snoring disease wherein just not the snoring, but the snoring that leads you to daytime drowsiness, daytime increased sleepiness, significant fatigue. That disease, or OSA as it is called, is one of the uncommon and it is one of the unidentified cause of blood pressure. The patient who suffers from it does not know about it because the snoring happens when you are sleeping. Only the partner of the patient or the kids or the family members can see this. And if you see one of your dear or near ones snoring heavily and not feeling fresh through the day, please get him checked for sleep apnea and inform your doctor to get that checked. Thank you.